Welcome to Module 5, Maintaining Eligibility. In this training module, we will cover the following topics: Washington Apple Health Medicaid renewals, post-eligibility review, program integrity, Washington Apple Health Medicaid suspension, and resources. Washington Apple Health Medicaid renewals. Renewal of Apple Health eligibility is required at least every 12 months except for Apple Health medically needed a spend down. A new application is required at the end of each 3 or 6 months base period. Alien Emergency Medical, AEM, the individual is certified for a specific period of time to cover the emergency only. Pregnancy Medical, a renewal must be completed after the 2-month postpartum period, and individuals turning 65 within the next 12 months. Individuals can apply for Classic Medicaid by the month they turn 65. Washington Health Plan Finder will attempt to auto-renew the individual's coverage 60 days prior to the end of the certification period. Individuals are automatically renewed for a new certification period when the electronic data sources show an individual's information such as Social Security number or household income is reasonably compatible. Individuals must renew manually when the electronic data sources show an individual's information may not be reasonably compatible. When an application is determined eligible for auto-renewal, the individual will be renewed for a new certification period, receive a pre-populated notification that summarizes their account, household composition, tax filing status, and other information related to the application, review the notification for incorrect information, and report any changes online, over the phone, or by returning the signed form via email or fax. Either and no changes, no action is required. The notification called Washington Apple Health Renewal Review Only informs the individual that they have been auto-renewed and will continue to receive Apple Health coverage. An example of this notification is displayed in this slide. When an application is determined ineligible for a renewal, the individual receives a pre-populated notification called Washington Apple Health Renewal Action Required that summarizes their account, household composition, tax filing status, and other information related to the application. An individual also must take action to renew. To be considered for Apple Health coverage beyond the current certification period, a signed renewal must be submitted. Individuals may submit their renewal online at www.wahealthplanfinder.org and select Update Application and Renew Coverage, or over the phone, or by returning the signed form via mail or fax. This is an example of the first page notice called Washington Apple Health Renewal Action Required. The letter will include a deadline and options to complete the renewal. A form with current account information is attached to this letter. The form allows individuals to submit updated information by mail or fax. Here are some additional pages from the renewal form. When can an individual renew coverage? An individual can renew coverage 60 days prior to the end of their certification period, and up to 90 days after the coverage has ended. If an eligible individual submits a completed renewal within 90 days after coverage close, Apple Health will be restored without a gap in coverage. If a renewal is not received, a termination notice is sent 20 days before the end of the certification period. When children turn 19, they are no longer eligible for Apple Health under their parents' application. In order for an 18-year-old to be considered for Apple Health for adults, a new application will be required. Children aged 19 to 26 may be eligible for a qualified health plan under their parents' application. Individuals who are active on Apple Health for adults and turning 65 will receive the Washington Apple Health Renewal Action Required notice 60 days prior to their birthday month. Individuals who are 65 and older can apply for Apple Health Classic Medicaid coverage online through www.washingtonconnection.org or by completing a paper application. For more information, please visit the Healthcare Authority link shown in this slide. Renewals for Magi Apple Health can be completed online at www.wahealthplanfinder.org by calling the Washington Health Plan Finder Customer Service Center or returning the signed and completed paper form via mail or fax. Post-eligibility review. What is a post-eligibility review, PER? PER is the verification process completed by healthcare authority staff when the attestation of income is not compatible with information obtained through cross-matches and the cross-match shows the client may not be eligible. Eligibility for Magi-based Apple Health is based on self-attestation, which is accepted at the time of the application or renewal. Income is described as not compatible with federal and state cross-matches when the income an individual attested to is below the Medicaid standards, but the data sources show the income is above the Medicaid standards, or the data sources are not available. Take a moment to review this slide. Individual's attestation is accepted at the time of the application or renewal. The information in the application is cross-matched with data sources. This determines whether a PER is needed, as you can see in this diagram. When an individual is not income eligible for Apple Health, the system determines eligibility for a qualified health plan, with or without tax credit. Please take a moment to review this slide. Let's apply what we have learned to a scenario. Scenario 1. Rose completes her Apple Health renewal and attests her income is $500 a month from her job. But the cross-match with Employment Security Department shows that it is $1,200. No PER is needed because the cross-match completed with the data sources find income below the Apple Health income standards. Scenario 2. Jake reports that his income is $1,200 a month from his job, but the Employment Security Department cross-match shows that his income may be $1,850 a month. A PER is needed because the cross-match shows Jake's income may be above the Apple Health income standards. Verification of income is requested during the PER. During a PER, healthcare authority staff check third-party sources prior to requesting verification. Third-party sources may include Employment Security Department and the work number, also known as Equifax or TOX. When healthcare authority is unable to verify income with third-party sources, a letter is sent to the primary applicant requesting at least 60 days of income verification. This letter is sent to only the primary applicant and any authorized representative who have permission to receive letters on the applicant's behalf. This is an example of a Washington Apple Health information request letter sent to an individual. The letter gives examples of acceptable forms of verification an individual can submit depending on the income type. The letter includes the income request, types of verification, the submission deadline, and contact information. All letters can be viewed in the Washington Helpline Finder Message Center the day after they are sent. Individuals are given 15 days to provide the requested information. Individuals can provide this information via email, fax, mail, and online. Individuals can provide documents online by signing into their account and uploading these documents to their document center. After the due date, Healthcare Authority eligibility staff check the document system for the requested proof of income. If verification is not provided and staff still cannot verify the attestation, eligibility is based on all information available. This may mean an individual could be eligible for a different program, including a premium-based program. If the requested information is not provided or verified income is over the standard Apple Health, coverage could terminate. Even if someone is over income, they still need to provide proof of income so eligibility for a qualified health plan can be determined. Individuals who do not respond are not eligible for other health care coverage. Here is an example of a termination letter sent to an individual when verification has not been provided and staff are unable to verify the individual's attested income. This letter includes what was requested, the date it was requested, and the date it was due. All letters can be viewed in the Washington Helpline Finder Message Center the day after they are sent. After a PER is completed and coverage is closed, individuals have the option to reapply for Apple Health. However, self-attestation may not be accepted. When income is not automatically verified through data sources, coverage will be in pending status and manual verification should be completed. What does pending status mean? Pending status means that coverage is not approved or denied, but verification is needed before eligibility is determined. When individuals are in pending status, a letter is sent through the Washington Helpline Finder requesting information to be submitted within 15 days. Healthcare Authority eligibility staff will process the application after the due date. As we mentioned in slide 26, individuals can submit information via email, fax, mail, and online through the Washington Helpline Finder. This is an example of a letter requesting information following reapplication for Apple Health. The table displays what is needed for verification purposes. This is the second page of a letter requesting information following reapplication for Apple Health. It provides examples of the types of verification an individual can submit. Program integrity. Insurance fraud is the intentional underreporting of income to qualify for insurance coverage. This may result in severe penalties for the assister, the provider, and the applicant. The penalties can include, but are not limited to, loss of coverage, provider referral to the Office of Program Integrity, termination of privileged user access in Washington Health Plan Finder, criminal prosecution under Washington state law. If you suspect that an applicant, navigator, or assister is being less than forthcoming when reporting circumstance or income, protect yourself and report any suspected fraud. If you have any questions or concerns or would like to report any suspected fraud, please contact Healthcare Authority for Washington Apple Health at wah.eligibilityfraud@hca.wa.gov or Health Benefit Exchange for Qualified Health Plans at compliance@wahbexchange.org. Apple Health Medicaid suspension. What does it mean to suspend Apple Health? Suspension means that an individual on Apple Health has had their full scope health care coverage reduced while institutionalized. When the individual becomes incarcerated, their coverage gets suspended, which then limits their coverage. Full scope means an individual will be eligible for all Medicaid benefits and services. And for those who are suspended, coverage is limited to inpatient hospitalization only. Once the individual is released from incarceration, their healthcare coverage returns to full scope. This is all done in the background without having the individual's healthcare coverage come to a complete stop and without the individual having to go through the process of reapplying to get their healthcare coverage reopened. Studies have shown that suspending coverage for individuals who are incarcerated rather than terminating their coverage will provide stability of care for offenders once released. Other requirements of the bill for individuals who do not have health coverage is to enroll them in Apple Health while incarcerated and suspend that coverage so it is available at release. This facilitates continuity of care and makes care coordination prior to the individual's release more manageable for a smooth transition. Upon incarceration, an insured individual ages 19 to 64 can be enrolled through Washington Health Plan Finder. The system will suspend coverage automatically overnight. Here is an example of what the suspension process looks like. An individual is taken into custody at 6 p.m. Friday night. Saturday at 12 a.m., Healthcare Authority receives the statewide jail booking data and full scope coverage is suspended. Saturday night at 5 p.m., the individual is released. Sunday at 12 a.m., Healthcare Authority receives the statewide jail booking data and full scope coverage is reinstated. This table reviews correctional types and potential full or limited scope coverage. Eligibility for full scope Apple Health depends on the living arrangements of the individual. In general, it follows the rule of where you lay your head, which means that individuals living in their home are eligible. Those in a public institution are not. Individuals participating in electronic home monitoring are generally eligible. Do individuals on work release have their healthcare coverage suspended? Individuals on work release from most cities and county facilities have limited scope coverage. Individuals on work release from most states operated facilities have full scope coverage. Resources. For more resources and training materials regarding Apple Health Medicaid and the use of Washington Health Plan Finder, please visit the Healthcare Authority Training and Education webpage at the link shown on this slide. For additional training on Apple Health Medicaid suspension, visit our Medicaid suspension webpage. For community partners, Healthcare Authority has made available a team of eligibility policy representatives to provide assistance for questions regarding Medicaid eligibility and assistance with Washington Apple Health applications in Washington Health Plan Finder. These representatives serve specific counties. For more information about Washington Health Benefit Exchange, please visit www.wahbexchange.org. Congratulations! You have completed Module 5 of the Healthcare Authority Community-Based Training. Please continue on to Module 6 of the 7 modules Healthcare Authority Community-Based Training. Thank you.